I am Tiffany Neiman, and this is Savannah Neiman, and we are from Clear Lake, South Dakota, and I work at SDSU as a laboratory support specialist. The delivery with Savannah was really quick. It was really, I don't want to say easy, but it was really smooth and really, like I said, very quick. Being that this was our first child, both my husband and I really didn't know a whole lot of what we were getting into and what to expect. Granted, we live on a ranch and we've got calves and stuff, and my husband has helped out with that several times, but it's definitely not the same as a real birth. And so both him and I weren't really sure what to expect. And so we both talked and agreed that we would like to have somebody there just kind of to coach us and to be there for us. And I also wanted somebody there to kind of help with just some massage techniques and breathing techniques, so that way I could keep this as an unmedicated delivery. So for myself, there wasn't really too many reasons, but I kind of kept telling myself, women in the past have done this for thousands of years, without medication. And I told myself, I should be able to as well. And that was my biggest goal, is just to keep it unmedicated and as natural as possible. So she originally came in and asked us, what we wanted. That was the biggest thing for us, is somebody that comes in and knows what our needs are and our wants are. And so that's what she did, is she came in and she asked, what we were expecting to get out of this. And that was really helpful, because I didn't have to worry about her overstepping her boundaries at all. But that was the first way. But then also we expressed to her that we wanted my husband to be involved as well, and that was really important for myself. I didn't want him just to sit on the sidelines and just watch everything going on. So she kind of showed him, some things that would be helpful for me, whether it was just, holding my hand or just talking me through some stuff. She gave him some really good advice, and then she also was really helpful with her massage techniques and helping recognize when I was getting a contraction, when I was coming down from a contraction, and how to breathe through all of that. So my coworker was actually one that first suggested to me about using a doula during my birth, and she had used a doula for all three of her children, and expressed to me how beneficial it was for her and how she was able to stay unmedicated because of using a doula and going through those massage techniques and breathing techniques. And she was definitely one that encouraged me to go that direction. I did check into the Brookings Health System doula program and found that the service was actually offered free for patients, and that was really key and really big for us. So the nurses and support staff were fantastic. They also were ones to check to see, what we wanted out of the experience as well, and were very understanding throughout the whole process, even if, sometimes people are more apt to lead a certain direction on their preferences, but if they heard my preferences, they were definitely willing to accommodate towards that. And they were always there to help with Savannah as well. Us being new parents, we didn't know a whole lot of what to expect and what was going on. And so whether it was helping with her or helping with me, they were definitely very accommodating. And then also with my husband as well, that was also a big part as well, because we came in here as a family, not just her and I. And so they were willing to help him out and accommodate him as well. So my care with Dr. Bennis was absolutely fantastic. I've had some previous health conditions in the past, and so going into the pregnancy was a little nerve-wracking for us just because of those conditions. But even before she sat down and met with me for the first time, she was already up to date on all of my past medical history, and she was on the phone with other doctors down in Sioux Falls just to see how she could better accommodate my birth and her delivery as well. So They were absolutely fantastic, and every appointment was always very thorough. She made sure that, I understood what she was talking about and understood the procedures or understood my scans. She was always very accommodating for me. I'd say just everybody's knowledge and willingness to work with us. That was definitely a big thing for us. And then also just having people around that were available for resources, whether it was younger staff with newer tips and techniques or older staff that, have done this a million times. And so that was a big thing for me, is just having those resources around for myself. I definitely would recommend it to other people in the community just because the care has been so fantastic from beginning to end.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.